Good morning, everyone. In the news now is an article that is very important to listen to intently. You can follow the link to this article in the description below this video, as well as in the first comment. And this article deals with vaccine hesitancy. And not just that, how to respond to vaccine hesitancy. And of course, it's on News 24, owned by Naspers, the people that control the narrative in the country. And if you go through this article with me, then you will see the tactics that are being used now to take people's freedoms away one bit at a time. And that is something that I have a huge problem with. Now, anyone is allowed to go out in freedom, in liberty, and say how they feel about something and try and convince someone of something. It's fine if you want to do that. But to say that you are right at the onset, to me, is not a free mindset. And you'll see the tactics that are used here are very much in line with Adam Weishaupt's Bavarian Illuminati, and that those are well-used tactics, and that we need to use similar tactics to ensure freedom in the future. And we have been, and we've been successful. But I want you to understand that this is now turned into what they call an infodemic. So they are saying this is an information pandemic, and that conspiracy theorists are on the receiving end of this. So there are 600 infodemic trained people that were trained by the World Health Organization in South Africa that's going to be going into rural areas and many other places to actually try and get these people to be vaccinated. And the interesting thing is that the rural areas has had the highest uptake of vaccines. It's still very low, the numbers, but that the cities has had the lowest uptake. And they must be very concerned about this by now. And if they haven't realized by now that the people don't want to be vaccinated, then I don't know why. And they're trying to convince people in this article that it's got nothing to do with the infodemic, but that it has to do with access to vaccines, the fact that people don't know where to get vaccinated, etc. And this is a story they're trying to put across. And then they also try to put across that once you go past the 50% point, something that I've mentioned at length before, once you go past the 50% point, then it just becomes a popular thing to do. And as I go through the article, you will see them laying out all of these things in detail. So please bear with me. This is important to understand the tactics, because if you understand the tactics, you can know how to maintain freedom throughout all of this. Freedom of information, freedom of thought, freedom of idea, because this is vital. So, headline of the article again, COVID-19, how to respond to vaccine hesitancy. And I'm not telling people to take vaccines or not. You should have a choice, and you should understand the tactics that are being used to coax, almost blackmail people through government and especially corporations into taking a vaccine not to lose their job. And to me, those tactics are the tactics used when you start a revolution in a country. And it's unacceptable that we have reached that stage. Completely and utterly unacceptable. And anyone in the world that thinks that this is okay to do will live with the repercussions, because the repercussions are coming. And I don't want those repercussions to happen, because instability in any country is unhealthy. I don't want instability. I want things to happen in as stable a way as possible. And we do have to transition to a new governance system as fast as possible. I will keep on repeating this over and over. Into the article now. Cape Town GP Dr. Carol Bosch, who works with hundreds of families, shared her experience and her advice, along with some reassurances for those who are uncertain about their options. And this is in a video at the top of the article. There's many GPs, and this is one thing that I don't understand, that I've spoken to, nurses that I've spoken to, they don't agree with them. So when they speak of health professionals saying, oh my word, the people don't want to get vaccinated when we're doing all this hard work and we're seeing people dying, I'm speaking to loads of GPs and nurses that say the opposite. So I'm not there I haven't spoken to any of these GPs that say something else. Maybe we should put them all in a room and then they should fight it out. But there are definitely different opinions on the ground based on what people experience. Initially hamstrung by low and uncertain supplies of COVID-19 vaccines, government is arguably now in a better position to campaign actively to accelerate vaccine demand, albeit in the midst of an often harmful viral infodemic. So now they admit that this infodemic, as they call it, is viral. In other words, it's much stronger than they thought. But later they will contradict themselves in this article. Dr. Peter Benjamin, co-founder of Health Enabled, a firm of digital health architects. Digital health architects. Remember that term. And Professor Glenda Gray, remember her, CEO of the South African Medical Research Council, say with a more secure vaccine supply in the last 2 or so months, the focus has shifted to overcoming vaccine hesitancy and accelerating the rollout. So, they are focusing on this infodemic. Gray also played a critical role in getting the Sisonke study off the ground. Close to 500,000 health workers, or guinea pigs, were vaccinated in the Sisonke study prior to the launch of South Africa's mass vaccination program on the 17th of May. I have a huge problem with this. The fact that you put your health workers at risk in a study is unthinkable. And when we change the governance system, maybe these people need to answer for the actions that they took, because the new administrations are not going to back their actions. Dr. Caroline Lee, the founder of the Healthcare Workers Care Network and an anesthetist at the COVID-19 coalface, also shared with Spotlight how anti-vaccine protests and sentiments have sowed despair and hopelessness among many beleaguered medical professionals dealing with severely ill and dying patients at the peak of COVID-19 waves. While I know many medical professionals that were there and that supported these protests. What emerges from these experts and several social listening surveys, so they're speaking about these experts. Now, I know both sides of the expert story, and several social listening surveys appears to be an evolving answer to the slow vaccination uptake dilemma. A slowly evolving answer. So this is pure speculation. The evidence suggests that hesitancy, mistrust, and conspiracy theories actually contribute far less to vaccine hesitancy than vaccine accessibility. That is a propaganda statement because it's not quantified at all, and neither will they be able to quantify it. This is something they want you to believe. This is why they are saying it in this way. This is perfect Adam Weishaupt strategy. Access to vaccination is limited by barriers such as the location and numbers of vaccination sites, difficulties getting time off work, the cost of transport, not having an ID book, and lengthy vaccination queues, especially in lower income and more rural areas. The irony is that the rural areas have been the most vaccinated, even although it's very low percentages, and we'll get to that just now. Those rural provinces that have taken vaccination teams from village to village, like Limpopo, have recorded the best vaccine uptake, especially among the vulnerable elderly. That means that the premise earlier is wrong. It's not a correct premise. Now they speak about the 50% tipping point, something I've told you about at length. And if you have not watched my previous videos, they're there. Take time, go and watch them, and then you will understand what I mean by the 50% tipping point. Benjamin says that global research reveals that once the magical figure of 50% of the population is vaccinated, hesitancy declines fast and getting the jab becomes the new societal norm. Understand what this means. And this is why our strategy is the one that it is, where we're growing a critical mass of people because of this truth. This is the truth. Unfortunately, once your numbers get to a certain point, many people just start to follow as it becomes the most popular thing to do. And this is how widespread the information on vaccines is in the population, in the social media space. And they've underestimated this, that it's the most popular thing, even to not be vaccinated. So they believe they can turn this around, and we will see what happens in future. And I quote, at that stage, 50% vaccinated, everyone knows someone who's been vaccinated and their leg hasn't fallen off 30 minutes later, nor have they broken out in hives or something equally terrible. Attitudes at this point shift to a fear of missing out, or FOMO as they call it, he says. So they understand the psychology of humans. I've mentioned this at length before. And where does this training come from? The World Health Organization, who is a subsidiary of the United Nations, who is controlled by the Committee of 300. Some 26.4% of people in South Africa have received at least one jab so far. It's not even 30%. It's not even a third of the population at this stage. The jab sites are standing empty. That tells you the story. And this is in metros. In metros, they have the worst statistics where people have cars. Surveys by the MRC and University of Johannesburg suggest that over 70% of South Africans are in favor of being vaccinated. Well, this is not true if you look at the actual evidence on the ground. A movable middle, or some 20% of people are equivocal, want more data, and believe some of the misinformation or disinformation, often inadvertently and or carelessly spread it. The survey suggests that only 10%, possibly even fewer, of people in the country are diehard anti-vaxxers. Some of this 10%, says Benjamin, are extremely vocal on social media and advocacy platforms, grabbing headlines and creating the false belief that their numbers are large and growing. The same count for the opposite. Exactly the same. You are using News 24 to spread your propaganda, what you want people to believe, because you're not showing any evidence. There is no evidence for what you are saying. The evidence for vaccination hesitancy shows in the numbers that have been vaccinated. It's that simple. Vaccine demand acceleration team. Here we go. Intervention time. Benjamin is one of 600 people trained by the World Health Organization, the WHO, in infodemic management. Yes, people, this is not about health anymore. It's now about controlling your mind, and sits on the National Health Department's 12-person vaccine demand acceleration team, formed in late August. The team is headed by former Love Life chief David Harrison. Go and look at the history of Love Life and try and understand where comprehensive sexuality education came from in schools. The vaccine demand acceleration team includes specialists in media, statistics, and behavioral science. Dr. Benjamin says they're busy setting up networks where, whether they're faith-based, women or youth organizations, will find a way to connect. People, just understand, these people don't care about your opinion. They will go to your child and influence them at school, and you won't even know about it. We'll also work closely with the Department of Cooperative Governance and Traditional Affairs and the CGIS, the government's communication and information systems, among a host of other outfits, he says. Benjamin has also led South Africa's social listening team since January this year. This team is embedded in the Risk Communications and Community Engagement Working Group of the Department of Health. It produces weekly reports on vaccine sentiment, rumors, and misinformation. You can see the report for 21 September here, and I will cover that in another video. Our motto is to listen, understand, and engage, he says. At the end of the day, they have one end goal, and that's to get you vaccinated. It's not about listening. It's about being able to adjust tactics based on listening. Stimulating vaccine supply and demand creation. Stimulating demand for vaccination is, however, not only a matter of countering vaccine hesitancy and anti-vaccine sentiment. It's very hard to create demand when you're unsure of your supply. So in my view, the whole vaccination response was tempered by this uncertainty. Then we had lots of setbacks, said Gray. These included reports of very rare blood clotting related to the Johnson & Johnson vaccine, now we're getting somewhere, that caused a temporary delay in its use, contamination of batches of Johnson & Johnson vaccine at a factory in the United States that led to millions of doses, some of which were to be used in South Africa, having to be destroyed, and suppliers suddenly stopping scheduled deliveries without explanation. You can't be in a situation where our demand outstrips our supply and you have tens of thousands of people mobbing vaccination sites to get jabs, says Gray. That never happened. Don't lie. It never happened in South Africa. They had to beg people to come. The vaccination sites are not being mobbed. They are empty. She adds that the government's communication strategy had to be tempered and the rollout modulated because of the supply issues. So what they are saying is they're going to be so in your face now. Like, I got an SMS by the government saying, do the right thing, go vaccinate your family. It's going to be a mass propaganda rollout. They're going to make people feel that you are one of those missing out, the FOMO idea. And so far, it hasn't worked. And I'm afraid that the 10% that they think are anti-vaxxers, when you look at the COVID-19 vaccine and all the media, the mainstream media around it, I think a lot of people, as the polls have found, are hesitant of the vaccine and the processes followed, the time frames followed, etc. And like I've said many times before, I'm not an anti-vaxxer. Many of the people I've spoken to will not take the COVID-19 vaccine, and they're not anti-vaxxers. It's their choice. They don't believe that correct processes have been followed, and it's up to people to convince them otherwise at some point in time. And whether people will be convinced otherwise or not, I have no idea. I make my choice, and I won't even tell people my choice on a platform like this. Many people know my choice, those that have asked me, and I have my reasons for it. And it's a private thing, just like voting. You don't stand in a voting booth where everyone can see where you're making your mark. And that's how it should stay with us, and their propaganda shouldn't change it. Gray says that a media strategy around addressing people's concern is now both timely and urgent, and that has started a long time ago. It's time to understand the hesitancy on those we've not yet reached and address some of their concerns. At a global level, everyone is getting vaccinated. South Africa is not special, with worse side effects than anyone else. Of 29 adverse reactions reported to SAHPRA for probing, not one has been linked to COVID-19 vaccinations. The very same vaccines have been rolled out to billions of people worldwide with very few adverse reactions, which indicates their safety, she adds. Is this true, Professor Gray? How do you know this? What evidence do you have for that? Oh, you can't have the evidence because not enough time has gone by. Because adverse reactions can actually happen over years. As has many claims in the US and many other countries that have paid out billions of rands for injury that happened later. So Glenda Gray, you can't warp time. Who is getting vaccinated? Benjamin says the electronic vaccination data system, EVDS, was being used to monitor daily vaccination numbers by, among other things, health facilities, district, province, and age groups, and whether people have private medical insurance or not. Medical aids are a close proxy for wealth, and our socioeconomic disparities are huge. Most vaccination is among public sector health care users, yet those with health insurance are twice as likely to vaccinate, with Limpopo being an outlier. An anomaly, but not a contradiction, is that more education is associated with vaccine hesitancy. Okay, so this is confounding them, because in the rest of the world, the people that are higher educated, okay, are being vaccinated. In South Africa, the people with higher education are not being vaccinated. And this shows in the vaccine uptake in large companies like Eskom, where very few people, not even 20% of the workers, have been vaccinated, and most of them are skilled and trained people. It's the white, educated middle class who don't want the vaccine, yet they can generally get it more quickly and easily than other race groups, so the vaccination percentage is higher, he says. So, there's your evidence. The people don't want to get vaccinated. They have access to vaccination sites. They all have cars to drive there. So, why are you trying to create a narrative different to this? And then it speaks about the impact on healthcare workers and the return to normal. And I want to cover the return to normal part before I end off this video. Lee believes fear lies at the root of most anti-vaccine sentiment, and that the best persuasion is to show protagonist countries where vaccination has led to a return to packed sports stadiums, busy restaurants and pubs, and social normality. Now, this is once again not ethical methods. This is Bavarian Illuminati methods. And it's really, really sad that that is what you have to go to. Not evidence. Show what you can have. We will give you this if you do that. We will give you a packed sports stadium. We will give you a filled-up restaurant. However, you have to give up your freedom and do this. She believes sharing relevant data like vaccination uptake and mortality in specific areas in easy accessible visual form plus pictures of revived economies and freely moving populations will help. Have they considered that you can actually do that without any of the things that you want to force down people's throats? You can just make a decision, but you won't, and that is the problem. Just don't give them too much information or try and counter the anti-vaxxers with data. This is this person speaking of people as sheep, as a thing. Just don't give them too much information. Them. Who is them? Us. Is this how you speak to us? Just don't give them too much information or try and counter the anti-vaxxers with data. You need to find out what questions people are asking and answer them. Help them persuade themselves. When you push too hard, they don't listen completely and push back harder and harder. For so many, it's easier to stay frozen in inaction and not try something new when it sounds so scary. Try something new. Are you serious? Really? What you should be doing, this is really infuriating, and I'm not interested in getting upset anymore over these things. Stay frozen in inaction and not try something new. This is like someone saying, have you tried this drug? Try something new. Seriously, how about hard evidence? Maybe people are more educated than you think. Maybe they are questioning things because they have real questions to ask that are relevant, based on real information that they've received. Consider that and stop propaganda and bring real, hard evidence. Prove to many of these people, if the person doesn't believe that a virus exists, show them the virus, show them the process of isolating that virus. Prove to them that disease exists, prove it to them scientifically, and then the vaccine hesitancy will go away. Thank you very much for watching this video. If you want to watch the members' videos, then click join underneath this video, become a member of this channel, and you'll be able to watch the more than 30 videos available there, including last night's live chat, where I revealed many things like I usually do every Thursday evening at 8 o'clock for the channel community members. And I really want to thank everyone that is part of that community. It's really special. We are growing, and we need to grow that community to be able to make the solid work on the ground happen and let that information spread throughout society. Use your discretion. Remember, we have to use on the ground tactics. This is very important because this is the mainstream media, and this is what they're going to do to put propaganda out there in the world. We have been more effective than they can ever imagine. Thank you very much for watching. Till the next video.